My name is Dan Winkle. I originally trained as I'm still practicing in physical medicine and rehabilitation. I'm standing here, Michelle talked a little bit, because of burnout. And so I was 3 years into my practice, and I could no longer function in medicine. All the training and everything that I just went to work, and just didn't like what I was doing. Always wanted to do something maybe more or different. And after about 3 years, I became unable to go to work. And that was a couple years ago. And so started working more with integrative medicine, particularly mind-body medicine, and through the International Organization Centers for Mind-Body Medicine. And so I've integrated all these things into a practice. I take care of inpatients, so people hospitalized for acute rehab, and then outpatient as well. Primarily in physical medicine and rehabilitation, we're dealing with a lot of chronic problems. So one of the new medical models that we're working with through the center is placing self-care in the center of medicine. And so for chronic problems, it's really what helps people. You know, the drugs don't cure diabetes. Metformin turns into glucophage, turns into insulin, turns into 80 units twice a day, and all the complications if you don't address the self-care issues. In my line of work with chronic issues, I just got so frustrated with the drugs not working. They didn't fix any. You know, we work multidisciplinary with therapy and all of these different things. But what I did, my part of it, I felt very, very powerless, and that I wasn't doing as much as I could. So that's kind of my journey of how I got to this place of frustration and this new way of practicing. What is self-care? So self-care is like some of the meditations, the relaxation exercise we did, nutrition, guided imagery. There's autogenic training, which uses phrases to activate the parasympathetic nervous system. Self-hypnosis, meditation, prayer, spirituality, social activities. All of these things are self-care. What exactly is mind-body medicine then? Well, mind-body medicine is about it's very experiential, and so we're going to do an experiential exercise here, but it's about developing techniques that can enhance that self-care process through functional MRI studies. And in many of the work they've done, they've taken people that are meditating and they do FM functional MRIs, or there's a diffusion tensor MRI. So it maps the connections in the brain, the density of the connections within particular regions. In general, more connections equals a healthier part of the brain. As you go to disease states, you get less connectivity. So connectivity increased in the hippocampus, so for memory. It was in the cerebellum, balance, brainstem, so the most dense neural network, you know, within the central nervous system in terms of nerve density. Areas within the amygdala, so emotional regulation, prefrontal cortex. So all these different places began to become more connective, so they could look at the gray matter densities. And so these things actually influence your neuroplasticity. They rewire the brain. So, you know, when people are really, you know, talking about lower amounts of stress, all of these things, it's happening from driving the neuroplasticity. One of the things that drives neuroplasticity is repetition of action. So I tell people, if you come in and you breathe with me for 5 minutes, you may feel better. But this has to be your self-care. It has to be your lifestyle issue if you want to really drive that process. We're kind of figuring out we need to do self-care to be healthy. Think of when you've ever had a nightmare. Your senses are shut down. They're turned off. You have more of maybe psychological senses, or you're dreaming, you know, turned on. But if you have a really bad nightmare, I've woken up in a sweat and your heart rate's pumping. My blood pressure's probably way up, right? So your body reacts to what's going on in the imagination or the psychological senses. So we know that this is happening. When we're awake, that's kind of going on in the background. There's this interplay that we're maybe more aware of what's going on here, but also that psychological interaction's always going on in the background. There's a recent study, it was American Heart Association journal did a stroke study, 2014, showing that depression and hostility were independent risk factors from stroke, aside from blood pressure, aside from whether you were exercising or all the other different risk factors. So these are showing up as different factors. So understand emotions are supposed to be our friends, and they aren't always. But there's all these different types of factors that can go in. An emotion can become stuck, repressed, or healthy. Healthy, they come up, they come down. Sadness, crying helps us not get stuck in bereavement. It helps us fight depression after we lose the loved one. So those tears and the sadness is normal, but it's meant to come up and down. When sadness gets stuck, we become depressed. When fear becomes stuck, it becomes anxiety. When paranoia becomes stuck, we get psychosis. So we can think about the emotions like that. When anger becomes stuck, it's hostility all the time. There's three main types of meditation. So there's concentrative, where you concentrate on a particular element, usually the breath or a candle flame. Mindfulness is just simply trying to you're usually mindful of as much as you can be aware of in one particular moment. And there's active. Active is the oldest type, where groups of people used to get together. If you look at like Native American powwows, there's African types, Aboriginal types. All societies had something where they got together, and it wasn't just to dance. It was actually about an active meditation. So what we're going to do is one today that really can help unstick emotions. Moving up from the ground, feeling grounded. Well, I think what we've been working on too is building a healing community. So just like, we have our community of, as physicians, and we, like what you were saying, the doctor's lounge and coming together, that's sort of been disintegrating to some degree. And I think our institutions in some ways are failing us, almost urging us to come together, in unique and different ways.